Jason, I thought that we would focus then on your passion, and I got to share that passion with you, which is clinical trials, clinical research. I started my research center 13 or 14 years ago now, and after running hundreds of trials at this point, I still love it. I really think it makes me a better doctor. I'm able to care for patients better. It makes me a better speaker. It just really hits on all aspects of what I do. When did you start your research career?
Yeah, I mean, if I'm honest, I was always kind of research first and then medicine second.
Mm.
So, going through training, I was in, chemistry, biochemistry, and I thought maybe eventually I would, get a PhD or run a lab. And I think the pull towards applying that, the true translational science, I think hit early on, brought me to medical school. I spent time at the NIH during medical school, came back, you know, did some translational work, some basic science work, molecular profiling, and really kind of saw that intersection between using the science to answer clinical questions or to develop new therapies. And that's what really pushed me towards my master's in clinical investigation. So I was at Rockefeller University 3 years after my residency, and I was 4 days in the lab, day in clinic. And that for me was just kind of that perfect balance. So I don't think research ever wasn't ever a decision. It was always something I did. It was just that I eventually found a way to keep the clinical care sort of at every day with the research, and the clinical trials does that. It's like you're using new therapies and new mechanisms. You're taking care of patients. You have more time. It feels like a little slower approach than able the cattle herding that I think the system wants to push on provider. So it gives me a chance to stop, think, digest, work through hard problems. And it's actually just something that's always been with me.
Yeah, it's funny. Your your path is a little bit different than mine. I was seeing patients. I had done a little bit of clinical research and some benchtop work in medical school, but otherwise, I was seeing patients just kind of in the grind. And at
Mhm.
some point, probably 10 years of my career, I decided, you know what, I really need to do something to just to make things a little bit more interesting, right? Otherwise, I
Yeah.
felt like I was going to get burned out. And
Well, and that's
the,
not uncommon. We're seeing that in our colleagues, and I do think it's really important that you have those periods. So there were years where I just had these high volume clinics, high throughput, but you set the foundations. I think those aren't as stimulating and intellectually challenging as that there's a point where after so many skin checks you're ready to kind of pull back a little bit. So inflammatory conditions, they give you that little bit of extra detective work or a challenge. I love when those patients come in and they're like, I've been to 4 or 5 other doctors and no one knows what's going on. I'm like, that gets me excited for that extra effort. And I think we've gotten away from the medical derm a little bit more towards some of the other areas. But the medical derm is satisfying that these patients, they're just so miserable, and to give them their lives back is very satisfying.
completely agree that, for the medical patient, you can find such career and personal, intellectual, emotional satisfaction by helping someone who's suffering so much. And you can, with the tip of the spear treatment, you can, find something that helps them that nothing else so far has.
Yeah.
And that is an incredible part of clinical trial work.